our first child. Oh, many people become doctors. This one will come. Ah, no, 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 no. Do it like this. No, 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 no. Take this one. Grandma, grand in-laws, everybody, they are giving one advice, or even those who have never given birth before, they must have something to say. Do this. All right. So new parents, next slide, are easily targets for all kinds. Next slide are easy target for all kinds of advice, whether they be good or bad, whether it comes from the checkout lady or the well-meaning relatives. All right. No, no, not that. Before that. Okay. Yeah. So, but it turns out that a lot of them, of those common wisdom, is not wise at all. All right. That some of them actually can be harmful. Okay. And so, in some instances, conventional wisdom is not only wrong, but potentially harmful. And so, we're going to be looking at what are these myths about babies and children. Next slide. So, the first one we'll be looking at is the myth about newborn babies should be massaged daily. How many of you have had that experience when, particularly our parents, when a baby is born, they believe that that baby should be massaged. And why do they believe so? So that it will help blood flow. Uh-huh. So, for example, they want to shape in the oh God, aye, babies have suffered though. And they say that is what I did for your husband. That's what I did for you. Eh? In fact, leave that in all these common sense people are talking about. You want to, you understand? To massage the head, to shapen it, massage the extremities and body to avoid stiffening. Hmm? And these are usually done by our grandmas and caregivers. But what is the fact? The fact is that the massage is only beneficial if necessary and done properly. So it has to be done properly. All right? Just like when you go to the spa and then you have a massage, sometimes you come out very relaxed because it's done by the professional and it is necessary. Okay? So children can be allergic to certain massage oils and other items used. And if done very roughly, can sometimes damage baby's delicate bones. So we need to be very careful, all right, about the baby has just been born. I don't know what we want to massage. We want to shape. What are you shaping? The head will form. I said, no, no, no. If you don't shape the head now, the baby head will not be long. All right. So that's that. So the next one is bathing newborns. This one is another very interesting myth that newborns should be bathed daily so that they can be clean. As if the baby went to farm and must bath. I say, if you don't bath baby now, baby will not start having body odor. So, but what is the fact? When it comes to bathing, less is more beneficial. Frequent bathing leads to removal of the normal microbial from the skin and thus exposes the child to potential harmful skin microbes. Abroad there are some when babies are born, sometimes for days they won't bath the baby. No year once the first thing they'll ask you, have you bathed the baby? It's like baby is dirty. Baby came out from the womb dirty, so you need to bath the baby morning and evening. And when you see when they're using soap and this thing to be, you'll be wondering what is happening. They say our baby has to be cleaned up, as though the baby went to farm. So that is another myth. So you only bathe when necessary. It's not compulsory that baby must bath every day when the baby is born initially. Because everything that the child will need as utero when the baby is born, Nature provides all of those things. So if you want to just quickly bathe the baby, remove, you expose the baby. All right? You can clean up the baby poos, you can wipe, and all of that, and then baby is fine. Then another very important one is the effect of shaking baby. Next slide. Ah, you know they can shake baby like this. Turn the baby upside down. Hey! And be shake. Say no, no, you want the baby to be fearless. You raise baby up and drop cat. So you want the baby to become strong. That is harmful. Harmful. Because you can have some hemorrhages. So at that time, babies' vessels are very delicate. They're very, very delicate. So you can have some intracranial bleeds, retinal bleeds, have cerebral edema, and God forbid, while you are trying to do that shaking, baby's head touches something. That thing can happen, and nobody will tell you. Nobody, you can't tell. In a bit, will say you want to throw baby, throw and fall from your hand, or baby's head will hit something, and then they say, what happened? And there are some babies who had some brain injury that were not detected at that time. Baby will grow, but baby will become retarded because of that bleeding, because of what happened at that infant period. So that is why this information is coming, so that we'll be very careful, particularly with our caregivers. We mothers will not do it. Mothers, they don't even have the hearts. It is our parents, grannies, they are the ones who, I don't want to use the word, will say, no, that is baby, you have to handle the baby well. And the ones. Not intentionally, they don't know what the harm is. Their intentions are right. But information is power. That is why we would know. Okay? So the effect of this shaking, you have the short-term. Okay, so okay, different from rocking. Now this is different from rocking the baby, which can be beneficial, which can have beneficial effects. All right? Rocking the baby, provide parental bonding, and help to manage colicky pains, and they can soothe the baby. It's different. When we say shaking baby, it's different from rocking the baby. All right? So the fact is that you never shake a baby. That is the evidence. You never shake a baby. So fast motion from side to side, lifting up the hands by both sides of the head, shaking baby's head. No, you never shake a baby. All right? Next slide. What are the effects of shaking a baby? You have short-term effects. And so that's what I said before. Baby can bleed inside the eye, the retinal hemorrhage, can bleed in the brain, intracranial hemorrhage. You can have massive brain swelling, cerebral edema. You can even have fractures, lacerations, and bruises. These are all things that can occur. You also have long-term effects of shaking baby. Severe brain damage, learning disabilities, blindness, paralysis, seizures, hearing loss, speech problem, behavioral disorders, and even death. So it is not allowed. It's unacceptable for you to shake a baby. All right? So who are the babies that are at risk of this? Preterms. That if a baby is born preterm, the baby is more tender, more delicate. Everything that baby is not yet fully matured, then they are the ones. Then infants, especially post-vaccination periods, after you have, the babies have been vaccinated, and children with some limitations or handicaps. So why does it happen? I was talking about the shaking. Next slide. Next slide. They'll say, but yes, commonest excuse. They'll say, why were you shaking? Oh, the baby was crying inconsolably. So leading to frustration and violent shaking. Keep quiet, ma. You shake the baby. Hmm? So, but we must know that crying is a normal phenomenon. That is the way the baby expresses and communicates to us that, see, I need something. And the baby continues to cry, means that you have not met the baby's need. A baby that is hungry, no matter how you shake baby will continue to cry until you give the baby what. The baby will cry. If you don't give food, the baby will cry, 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 get tired and sleep. But hungry. When he wakes up, he will still cry again. When a baby is uncomfortable because baby is wet, as weird or poo-pooed, and you don't change. And then some baby just need attention. They just need to be carried. Anytime a baby cries, baby is crying, all of babies, what baby is trying to communicate is that I need your attention. I need you to attend to me. Okay? Like I said, no baby has ever died from crying. So don't be bothered when baby is crying and then you have to now start shaking. No. Okay, so what are the prevention tips concerning shaking? Never leave your child with someone who may be stressed. Some of these things they do it out of frustration. You're trying to keep the child calm, and the child is still. You don't say it's okay now. Then never leave a child with someone who is stressed. Then don't take it personal. Baby crying is not your fault. That is what will lead to frustration. Why is this baby not keeping quiet? And then you now become frustrated. They have a plan for soothing the baby, stress release. They use certified child care providers. All right? And know your limitations. Ask for help if you need it. Okay? So that is that about the myth about shaking. Then we move on to the next one, which is the myth about breastfeeding. So, what are the myths? Breastfeeding and bowel motions. That if a child that is exclusively breastfed passes too many motions, mother's milk should be stopped. That means the colostrum is dirty. Oh no. That is a myth. What is the fact? Passing 5 to 6 motions and many more small ones is completely normal. As long as you're not giving that baby anything but breast milk. If the baby passes stool 5 to 6 times in a day, no wahala. Hmm? The breast milk should be continued to be given to the child. You must continue to give that baby. There's nothing like breast milk is dirty. Breast milk is not. Something coming from your body, how can it be dirty? I don't understand. Some people say, no, don't give. Can't you see this thing is not pure. That's why the baby is stooling. Baby is not getting. No. If it's only breast milk you are giving, then you are safe. But if you are giving artificials and the baby is stooling, then you need to be observant, just in case people who are doing that are not taking care of hygiene. Because in that, a lot of things can go wrong. Maybe the bottle or whatever, the feeding bottle was not properly washed or sterilized. The process of doing all that, you wash your hand. Attention was not paid to handling. Babies are very, very, very delicate. There's a process to preparing baby's food that must be. No pepper at all. Not I know. It took their grandma, mama. The mother surely just take something that is bland. No spice. Just white like that. Nope. anything that is healthy for you will be healthy for the baby. All right? And what we preach is moderation. Just as the way you cannot eat too much salt in your food, you cannot take too much pepper. You know, eating of pepper is a range from low level to high level. Me, I'm in the lower level. This is normal now. When I taste it, my mouth will be burning. But somebody is saying that this is normal. I hear that the people from the west they eat pepper a lot. That one is, but some other people small pepper. Uh, but what we preach is moderation. It must always be, in moderation. And when you do that, the babies will be fine. So another myth is that mothers who are breastfeeding should not eat garlic, onion, or chocolate. Have you heard that before? Yes. It used to be believed that eating highly flavored food while breastfeeding made an infant more fussy and causes gas and upset stomach. But the fact is, no, so no, we put query there. We put query there. So the way of those ones. Uh, so generally, we don't allow breastfeeding mothers to take alcohol during pregnancy, during breastfeeding, because we don't want the baby to taste it inside or outside. Before the baby will now come out. No, the alcohol in palm wine, it depends. Sometimes if it's produced fresh, it's not so much. But until it gets fermented. But generally, alcohol, no good. So you can use other things to generate. So some people will use the excuse of, I want to generate breast milk to be shark. There are other things you can use to establish breastfeeding. Okay? All those kunu, all those pepper soup, there are a lot of things that, yes, that breastfeeding mothers take. Basically, what generates milk is just fluid, dehydrated. The moment you are hydrated and you are not stressed, it will flow. Once the baby sucks on it and stimulates the nipple, it will flow. Hmm. Yeah, so yes, so we will get to that. So just note that question. By the time we are done with them. All right. So the fact is that study that monitored the eating of nursing mothers showed babies. No, next slide. Showed babies seem to prefer milk when their mothers are balanced diet nursed for longer period of time and actually gain more weight. So what that means is that, like I said before, what we preach is a balanced diet, a healthy diet. All right, excluding a woman from taking this, oh, take only this. No, it has to be balanced. Whatever it is that provides nutrients to you is good for the baby. So, carbohydrates, protein, fats, vitamins, minerals, water, they are all good, long as it's a balanced combination. All right, next slide. Yes. No, it's a myth. I mean, it's not true. Okay, go back. No, where they say should not take garlic. No, it's not here. Go back, not forward. No, you are moving forward though. Okay, wait. So, so the next one now. Yes, stop there. Onion or chocolate. Uh, it's a meat. That means it's not correct. You can eat onions. Hmm? So, it, just read. It used to be believed that eating highly flavored food with while breastfeeding may make an infant to be feel sick, cause gas or upset stomach. But the fact is that babies are shown to prefer milk when their mothers are on balanced diets, not for a longer period of time. They actually gain weight also. Hmm? So it's not true that mothers, breastfeeding mothers should avoid taking onion, chocolate, or garlic. Okay, that's why it's called a myth. It's a popularly held view, but not not correct. All right. So next slide. Stay on milk and breastfeeding. No. So a myth. Another myth is that breastfeeding woman must drink milk to initiate breast milk flow. And if you want your milk to flow, take a lot of milk. What is the fact? Nursing women do not need to drink milk to meet the nutritional requirement for breastfeeding. Allow the baby to suck and just eat balanced diet, and then the milk will flow. The factory will be producing at optimal capacity. Yes, initially it may not be optimal. To answer your question very briefly, women, the the time it takes for lactation to be established differs from one woman to the other. Some women, even before they give birth, it's already beginning to drop. So once they deliver, it's flowing. For some, it may take some days, and you need to do a lot. All right, do a lot. There are a lot of factors that affect the establishment, how quick lactation is established. All right, and that is why what is advocated and preached is that early establishment of lactation also helps. Meaning that as soon as you have delivered, baby should be put to the breast to start sucking. The earlier you start, the baby starts sucking and stimulating the nipple, then the earlier the breast milk will begin to will begin to flow. And also depends on the emotional state, the psychological state of the mother. If the mother is feeling so stressed out, there is no emotional support, nobody to help her, she will likely have a challenge establishing lactation. But if she's surrounded by love, a lot of support, then no time, breast milk, the lactation will be fully established. All right, so next slide. This is a very, very, a very, very important and popular myth. Breastfeeding and the shape of the breast. I'm sure a lot of you women have heard that they said, if you suck too much of my this thing will just become flat. So the myth is that breastfeeding will ruin the shape of a woman's breast and body. But what is the fact? Breastfeeding uses up to 500 extra calories a day of the woman. So actually, when you are breastfeeding, you're supposed to actually be losing weight and coming back to shape. Okay, so it does not affect the shape of the breast in the long term and helps the mother to lose weight among other benefits. All right. So it's not breastfeeding. A lot of time, what makes women to add weight is the eating while they are breastfeeding. They eat, they are breastfeeding for one, they are eating for three. So the excess will be stored. So baby cannot finish it. So it's not because of the breastfeeding, it's the eating that causes that. Yeah, well, it makes them hungry. Of course, you will feel. Well, I don't know. Let me not say you will feel. Is what you might say that okay when you've breastfed and it's like everything is there, you feel like you feel drained. Okay, you want to take something. So so women have to be intentional. Yes, you want to eat more, but it should be more fluid. You understand? Vegetables, things that just keeps you healthy and is able to provide the required nutrition to the baby. And then, of course, exercise. It's very difficult for Nigerian women to engage in exercise while they're breastfeeding. The activity that they are involved with reduces drastically. You know why? There are many helps around. Uh, Give me this one. Get me this. The kitchen has been taken over. They are just supplying you food because they just think that this one has to breastfeed. You need rest. You need to eat. And since you are not active, what will happen? You just start adding weight. So it's not the breastfeeding at all. All right. So it doesn't affect the shape of the breast. It doesn't affect the body, and rather the woman gets to lose weight among other benefits. So the next one is breast milk versus breast milk substitutes. So what is the myth? Mothers believe that modern formula milk are very similar or even the same as breast milk. Abi? Particularly those who plan not to breastfeed. They say, no, 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 no. I can't allow someone to I'm conscious of my shape. No, I can't. No, no, no. I'm very you understand? So they say no, it was those days. Now the formulas that are being produced is almost like breast milk, even better than even breast milk itself. They even add some additional nutrients inside. But what is the fact? Although formulas contain the correct balance of nutrients for an infant, formula products do not contain antibodies found in breast milk, which can help to fight infection. So, no matter what nutrients they put into formulas, the natural, God given food for the baby is the best. And so, we would encourage women to always breastfeed. So, what is the next myth? That burping during breastfeeding. Okay, what is the myth? That burping indicates that baby is full. But what is the fact? Burping, in fact, should be done in between feeding while shifting from one breast to the other, as it releases the air sucked in and helps the baby to continue feeding. It should also be done at the end of feeding to avoid gastric problems. So burping now when baby feeds and then you now burp so that baby will release gas. Why? Because while the baby is sucking, it's also sucking in air. So the air goes into the stomach and then so while you're sucking in between, before the baby finishes completely, like what is suggested, if you're moving from one breast to the other, bop. Bopping does not mean that baby is full. It just means that baby has just sucked a lot of air and you think the baby is full. No. Once you bop and the baby releases gas, the baby might want to take more. All right? Yes, so if you bop after breastfeeding, that's why you should bop after breastfeeding so that the baby does not also does not vomit or throw up some of the feeds. You know, well, I think it's something that all mothers they they do. You know, once they finish, they just breastfeed, and you don't be in a hurry because you just finish breastfeeding and then you just lie baby on the baby. By the time you come, baby would have just thrown up because there's a lot of gas. Baby will not be comfortable. But once you bop, the gas is released and the baby is fine. All right. Next slide. This is myth about baby nursing. And what is the first one? Babies can be spoiled if fed too much. Holding and responding to the baby's cries helps him feel secure about the world. It is common for parents to be so wrapped up in babies that we forget to put them down. Take advantage of time when your baby is quiet and calm to let him entertain himself or fall asleep on his own. All right? It doesn't mean that when you hold the baby too much, the baby will get spoiled. All right? What it does is that the baby just feels secured. You know, have you noticed that baby like to touch like what they call gum body? Babies always want to feel the body next to them. They always want to feel. They want to be carried. Once you put the baby on the bed, baby knows that the mother is not there anymore. It's not touching anything warm, and babies want to just have that. Uh-huh. But it doesn't mean that if you put the baby down, then there will be any challenge. And in fact, it does help the mother to also to be able to do other things too, and to also rest. You know, once the baby is sleeping, it's good for the baby to sleep on his own or her own, while the mother also catches some sleep and rest and do other things. All right. Yeah, I know. Some babies are just different. Are just different. So somebody must carry the baby. Mm. But it's possible that that started at the very beginning, from day one. Eh, and maybe did not. Yeah, it does happen. All right. So another myth um, is that a baby is constipated when if they do not have a bowel movement at least once per day. So some people want to make sure that baby they pass through every day at least pass through. How can baby feed and not release something? But this is the fact that babies that are solely on breast milk sometimes have bowel movement as infrequently as once a week. Yeah, once a week, infrequently they have bowel movement just once a week. Particularly those who are on exclusive breast milk, meaning that the baby finishes everything, nothing was left to pass. And that should not be a cause for worry at all. So another fact is that the baby is not constipated when they grunt, scream, turn red, or cry while having a bowel movement. If the result of all of these gyrations is a soft stool, the baby is fine. Those people think, baby will be turning like this. This baby is finding it difficult to pass through. This 2 months is very hard. Meanwhile, something soft does come out. It is normal. Babies have colic. You understand? Because their abdominal system is still trying to adjust and just come to mature and settle. So it's not unusual for babies to feel or to cry when they're having those abdominal colics. Usually after 3 months, it begins to subside. Okay. All right. So we'll take two more and then we'll stop. We'll continue next next time. Okay. So the next meat is standing with a bowl on the baby's leg. You know when babies have we call it what they call bow leg. So originally years ago, when children suffered from rickets, okay, that is vitamin D deficiency, it caused the softening of the bones, and then that resulted in the bending of the legs. But today, praise be to God, rickets have disappeared. Why? Because we don't have vitamin D deficiency anymore. We don't have vitamins deficiencies. The bones are stronger. Women are taking good care of themselves. They are eating well. The socioeconomic levels have increased, you know, and so we don't have that. Then, of course, legs of most babies already bowed at birth from being wrapped tightly around their bodies inside their mother's womb. Of course, as they come out, it begins to straighten out. So it takes years for them to straighten out, but allowing a baby to stand on their legs does not cause a bowing. So it's not because the baby stood on the legs. That is why the bowing took place. All right. So the last one we take for today is feeding infants cereals at night makes them sleep longer. You have to feed them very well so that they will sleep well. So giving solids before bedtime will not change when an infant will start sleeping through the night. Most babies will not develop a dependable sleep cycle until somewhere between 3 to 6 months of age. It's from that time that you can begin to say, okay, the baby now has a sleeping pattern. All right? Whether a child sleeps through the night depends on how they are put to sleep, where they are put to sleep, and how parents respond when they do wake up at night. All right? Cereals and other solids should not be started until 4 to 6 months of age in order to reduce the risk of allergies. Me, I would say 6 months, not even four. 6 months. 6 months. Let baby take milk. Let baby take breast. Hey, from when? From four. Why do you want to give power from four? From, uh, eating of eating what? Eh, that is good now. Sir, what do you think? Exactly. Eh? Yes. You see, the challenge we have is this day and age, because we have a lot of working mothers, it's become very challenging. And most organizations don't give maternity leave more than how many months? 3 months. So by the time you have done 3 months, you want to go back to work. And you cannot afford to say leave without pay because you need the pay. Because they don't pay you, for even that they don't pay you, there's trouble. So you are forced to go back to work and then you hand your baby over to daycare. So you will breastfeed, extract, and keep. By the time you come back, baby has finished. Meanwhile, you're at work and your breast is heavy. You want to go and feed, but you can't go because you have to work. So countries where they do 6 months and 1 year, me, I like that kind of place. So, mothers, what do you think? Women? Huh? Oh, 6 months to third. But it's still good now. It's still okay. Mm. So women, yeah, and those online. How many of you would want 6 months maternity? Okay, so Daniel, we're going to do a write-up to say that we are proposing. Ha, I know the employers of labor that will say, okay. I feel exactly. So, but generally, that is it. That's why. See, it is because of this that is why mothers try to introduce solid early, so that their children does not get do not become dependent on breast milk because they know that if they go back to work, breast milk will not be available. And if breast milk is not available, what do you feed the baby on? So by 3 months, when the woman is preparing to start work, you start introducing PAP, another series, so that if I'm not there, feed the baby with this one. And baby has no choice but to collect, but to collect. But we're saying that 4 to 6 months, 4 months, yeah, it's fine. If you start introducing gradually, then you start reducing the breast milk. All right, so thank you very much. Question? Yes. For baby to sit. Once baby is 6 months, baby should be able to sit. Mm. 5 months, 5 months. See, this thing, no hurry. Oh. There's no hurry. You know, milestones, there's what we call general milestones, and there's what we call babies can do before or slightly after, no problem. So by the time baby has done 4 months, getting to 5 months, you should now begin to see if baby can sit without any support. Or sometimes baby can sit and then you put the pillows, yes, just to support the baby. But by 6 months, baby is already able to sit. Mm. And, because at that time, baby is able to would have achieved head control. Yes. So not a baby sit and baby just do like this and then just fall. By that time, baby has already achieved head control. All right. Question. Any question from our? Okay. So there are no fixed rules, all right. But the thing is that when the baby is born initially, if you don't bath every day, there's nothing wrong. But you can clean, of course. Yes, you can mop the body. But they don't. The way they wrap babies, hi, the baby wants to be exposed and enter water.